So this topic is about lawyer's role or immigration lawyer's role in the immigration health exam. So this session will be including 5 parts. First, have a brief introduction about what is the health requirement, the public interest criteria for 005 and the public interest criteria for 007, and then the MOC, the Medical of the Commonwealth assessment, and then how to calculate the cost, and then the waiver provision, and then what we can do. So firstly, about the basic health requirement, the 2 public interest criteria. So basically all the visas have this health criteria, most of them, basically everything. 4005, public PIC 4005, it's in majority of the PR visas and some temporary or provisional visas, such as 485, 494, and 491, and 188. And then for PIC 4007, most of the temporary visa and some PR visas have this PIC. So for example, 186 transiting stream, TIT stream, and partner visa or child visa. So the difference between PIC 4005 and PIC 4007 is about that PIC 4007 have a waiver provision, which means this health requirement may be waived if you meet some requirements. And an important thing about the health requirement is in most of visa requirement, there's a one fail all fail rule, which generally speaking, if the family member of the primary applicant or if the secondary applicant of the primary applicant, they failed in the health test, the whole visa everyone in the visa application will be refused. I think Kris has previously introduced this part before, so you can have a look at the previous one. But we're not gonna focus on the one fail all fail in this part. So second part, what's the MOC assessment? So the MOC refers to Medical Officer of Commonwealth, and the procedure will be like you take after you apply for the visa, you will receive a referral letter for you to take the health exam. And after you take the health exam, if the MOC think there's some problem, you may not be able to pass the health exam, they will write you a letter called 884E form. And then when you receive the form, the MOC will mention what's the problem or what's the issue in your health exam. And if they think you failed in the health exam, they will just refer this result to the delegate, and the delegate will make a decision based on the MOC letter, their opinion about your health exam. So in considering whether a person passed or not passed the health requirement, the MOC will consider 2 facts. So the first fact is about the cost. We call it significant cost. And for the cost, the calculation method is about the annual costs of a person due to the conditions. What's the cost gonna happen by the Commonwealth government times the assessment period. And if the total amount is less than the significant cost threshold, which currently is 86,000, if the whole amount is less than that, you pass the health exam. If the cost is higher than that, means you failed. And the second criteria the MOC gonna assess is about the the access of PR and a citizen to such services. This includes only 2 things. One is the organ transplant and the dialysis. So if a person have no condition relating to this, so they will not consider this part. They will consider the cost only. But if a person has some condition relation to the organ transplants or dialysis, even if the cost is lower than this amount, they're still gonna fail in the health test. Next, so how to calculate the cost? So, the previous formula is that the annual cost times the assessment period, right? And for the annual costs, the MOC they have their own calculation methods, but we can see from this because notes for guidance. We can have a look at this. Yeah, this is the called the Notes for Guidance for Medical Officer of the Commonwealth. This includes almost all the conditions or diseases in the world. And medical officer, they will take this as a guidance and to calculate what's the cost will be. We just have a look, for example, this one, HIV. We can see that, for example, this is different drugs or medicines price, and there will be an estimated annual costs. So if, for example, if applicant he or she needs to take this kind of medicine once daily, right, and the cost for this person will be 2,600. And if a person needs to take different kind of multiple medicines, drugs, or whatever, we just add all the annual costs in together. And this will how the MOC to calculate your annual cost. So this is the guidance. So this is about how the officers to calculate the annual costs. So this is a reference. The second part of the formula is about the assessment period. And the policy, the immigration policy have a table for how to assess the period. Have a look at this. If it's a temporary visa, the maximum period will be the length of the visa, so itself. For example, it's 2-year 482 visa, it will be the period will be times 2, annual cost times 2. And for permanent and provisional visa, they have 3 different ways to calculate the period. So if the applicant is over 75 years old, it will be 3 years, annual cost times 3. And if the applicants have a reasonable predictable beyond a 5 years period for a permanent condition, or the person have a reasonable predictable to reduce the life expectancy. If in that case, the calculation, the assessment period will be 10 years. So annual cost times 10. And for others, all the others, just normal visa, they will be 5 years. So it is important for the MOC to calculate the assessment period, because 10 years and 5 years, which will have a very huge difference in the final cost. So we need to figure out whether assessment period is correct calculated by the MOC. When we calculate the cost, there is a test called hypothetical person test, and the landmark case for this is Robinson. Make it simple. Generally speaking, this test says MOC can only, when they make a decision to calculate the costs, they need to focus on these following 5 elements, which is the nature of the health condition, the severity of the health condition, the age, type of the visa, and the visa period. And this will be the only elements the MOC can and need to consider. For example, I am the applicant, right? I want to make an argument to the department saying, okay, even I have such condition, but I will treat my disease in overseas country, and I promise I will not using the Australian's medical resources. But it's not gonna work, because the hypothetical person said, if a hypothetical person with the same condition and the same scenario, he or she would using Australia's medical resources. Even if you say that I will not do this, but a hypothetical person will do this. So that's how the hypothetical person test used in the Robinson case. So basically speaking, once the MOC has confirmed or have assessed the nature of the health condition or the following, there is nothing further the applicant can argue, because based on the hypothetical person, the result will be the same. Any person with the same disease will have the same cost calculated. So you won't have a lot of grounds to argue, saying that, yeah, even I have this condition, I will not be a burden of the society. It's not gonna work. So that's how the Robinson case was referred to. Okay, so next part will be the waiver provision. As we did before, the difference between PIC 405 and 407 is about 405 has no waiver provision and 407 have the waiver provision. So the Robinson case, the hypothetical person test is the same, but based on that, if this visa requirement is PIC 407, which means the case of it, the delegate can't waive the health requirement, even if the MOC has an opinion that the person will cause a significant cost. So when the delegate consider the waiver provision, they will consider these 2 parts. First is significant cost, and the major consideration for significant cost is the following 3. So first, they will consider the compassionate and compelling circumstances. This is quite similar than the other compelling reasons, such like you may an Australian organization interests will be impacted, and if that's the case, we can establish the compelling circumstances. The second requirement consideration is about if you are a New Zealand citizen residing in Australia, the case officer will consider you to waive the health requirement. I don't know the specific reason, but I guess maybe New Zealand and Australia have a common agreement or treaty about their medical system. So probably this is the reason. The third requirement is about you have the capacity to mitigate the significant cost. Generally speaking, if you are rich, you can waive this criteria. And then about the prejudice to assess for this part, because it's only related to organ transplants and dialysis, right? So for the delegate, if applicants have a 407 waiver provision and related to the prejudice to access part, they have to refer this matter to this called the Migration Health section, which I think it's a different department in the immigration, different sector in the immigration. Yeah. And for the organ transplant, in the following two situations, they will waive your health requirement. So first, if one of your family member is able to donate an organ, which means you will not be a burden of the Australian society, okay, you will meet the requirement. They will waive. Or if the applicant have evidence saying it will be unlikely that the person can be placed on a transplant list, which means you don't, it's impossible for you to get an organ transplant. Yeah, you meet the requirement as well, because you will not be a burden of the society. So that's for the organ transplant. And for the dialysis, they have three considerations. So first, if you have a history of having the financial capacity. So this important thing is they considering the history, not only the current financial capacity. So you need to prove that you pay yourself for the dialysis before for a period of time, and you have ongoing capacity to pay the dialysis fee. That will be the first consideration. The second one will be your private health insurance can cover the cost. So it depends on the policy of the health insurance provider. And the third one will be if there is an agreement between Australia and the applicant's home country said that they to provide the dialysis services, it can be waived on this section. So that is how the 407, the health requirement waiver works. It's a little bit different from other waiver because it's not only compassion and compelling circumstances. They will also consider the other facts and especially the money. So what we can do as a lawyer to advise or help our clients in such scenario, because most of people may think because your health condition is there's nothing we can do to change your health condition. If you fail, you fail. There's nothing we can do. But no, sometimes we can at least do something to help our clients to get more chance to get the visa or have some other strategy. So firstly, if a client comes to you with a kind of disease or condition, the first thing we need to know is we need to know the diseases. What's this thing? So normally what I'm gonna do is I will search on Google, and there is a website called the Mayo Clinic. This website is pretty good because basically it will include all of the diseases and give you an explanation of what it is, what the symptom, what we can do, and what's the risk in the future. So I can show you this website, Mayo Clinic. It's very good. It can give you an overview of what the disease is and what's the symptom, what's the causes, what's the risk factors. And the following diseases, some cases I did before. I can give you some it's brief case study for that. So the first case I met before is a child, 20 or 21 years old at the time of application and applying for a child visa. The child has a Down syndrome, also maybe some place they call them the child developmental delay. So this condition, normally the person doesn't need to take medication, doesn't need to take any treatment or surgery, but they may need 7x24 carer support because they don't have the ability to live or doing some basic living activities. So this will cost a significant cost in Australia. And for that case, because it's a child visa, and child visa, as we know, it's PIC 407, which means you can apply for a waiver. And for that case, I asked my client to do a test, not with the Bupa Health exam test, but with another external doctors, to do a test to provide some indicators about whether the person have the ability to acting the life activities such as eating, wearing clothes, or even cooking. They will have an indicator showing that, okay, you have the ability to do that. You may have not so much ability to doing that. So there will be a report. So we're using this report to show that first the applicants can do some basic activities in daily life, and he doesn't need a 7x24 hours carer. And also we are providing the ability that the family can afford for a private carer for the child. And also they have another Australian child in Australia. So all of these we are applying for the waiver, and it works. So that's down syndrome I did before. The second one, the first time I read this word, I don't know what this is. So you can see, okay, this acromegaly is a rare condition in adults that cause some bones, organs, and other tissues to grow bigger. And the small gland in the brain called the pituitary gland drives these changes, blah, blah, something like that. And the symptoms are there. So for the client, her doctor back in China recommended her to do a surgery and remove something. And it's a 189 visa. So the applicant have the condition before launching the visa. And my suggestion is you do the surgery back in China before taking the health exam with the department. Yeah, she did that, and she's cured. While she's doing the immigration health exam, she disclosed the surgery history, but as all the health indicators shows normal, the department didn't require anything further for this and just passed the health exam. So that's how it looks. Yeah, but yes, as they say, the surgery itself, if it happens in Australia, it may cost a lot. And if you didn't take the surgery, they may have a possibility that to reduce the life expectation. This means the assessment period will come from 5 years to 10 years, maybe, which may increase the cost. Third condition I have is the uremia. As we know, this disease, we need the patient needs to do dialysis on a regular basis, and this will cost, and maybe the person need to do a kidney transplant, and this will cause the produce of the to assess, because it may be a burden of the Australian. May take Australian person's chance to do the surgery or do the dialysis and do the organ transplant, right? So it's might be a very serious problem in the health exam. And this is my apparent visa applicant, but they're still in the waiting period, so they don't need to do the health exam so far. So my suggestion is as well, they do the kidney transplant surgery back in China. So once they done that, all the health indicator, I think for uremia, it's called EGFR something. The indicator will shows normal, and if that case, when they do the health exam, they won't not find out anything wrong with the person, and probably they will pass the exam. But yeah, because they're in the middle of the surgery, so I don't know what's gonna happen next. But yeah, probably this will be a better solution for them. And yeah, the first disease, cancer, which is common disease. And for cancer, to be honest, there's nothing we can do for this such a serious conditions, because maybe it's called you need surgery, right? It may cost a lot, and it may reduce your life expectation. Make put the assessment period longer. And for the chemo and the other ongoing medicine, it will cost a lot as well. So the cancer itself is very difficult to cure. Even if you have the surgery, they may still have a chance to have the cancer again. So I think the MOC, they will take more consideration about the cost, be more careful in considering the cost. Even if you have the surgery already, they will still consider this very carefully. And the fifth is the hepatitis B. I think this is a common disease as well. And in the department policy, it says the hepatitis B and the C is not a threat to the Australian community. So for most of the person who have hepatitis B, applicant for hepatitis B, the department, they will not fail the health test. They will ask you to make a health undertaking. The health undertaking will be like a form. So before the visa is granted, you will require to sign a health undertaking in your language. And yeah, as we can see here, if it's inactive tuberculosis, HIV, hepatitis B or C, you are able to find the health undertaking and they will grant you the visa. And for the health undertaking, you need to regularly check your conditions, your indicators from your local doctors, and to make sure that all the condition itself is under control. After we have an understanding about the disease, normally we need to get a doctor's advice, not from Bupa, but from the client's just own doctors, to have a brief understanding about the treatment method, what kind of medicine they're gonna take, and this will help us to calculate the cost. And also we need to a doctor's advice that whether the applicant will have a predicable to reduce the life expectancy. This will relate to the assessment period. So we need to have a certain expert opinion from a doctor to tell us what's the treatment, what's the assessment period. And then we're gonna calculate the cost before a MOC do that. We can have a calculation first. So for the cost, if we're looking for medicine, we can go to the PBS website. Just type the drug's name or brand name. They will have a unit cost for basically all kinds of medicine. So we can have a brief idea about how much this medicine gonna cost. Also, we need to we can have a look at the treatment method, such as whether a surgery is required, and if such a similar surgery, if it's occurred in Australia, how much it's gonna cost, and also the care and the support costs. So we can have a calculation about the cost before the applicants go to the Bupa health center, and so we can give a more accurate advice to client that whether you're gonna pass the health exam or not, and if not, what we're gonna do. That's our other strategy. So we can have a brief idea first. So if we find out that the client may fail in the health exam, may fail the health test, what we can do? So we can ask the client to obtain a new advice from other doctors. In the new advice, the doctor may advise the clients to have a similar, but maybe a cheaper medicine or cheaper treatment methods. So we can provide this advice to the MOC, and they will take this into consideration, saying, okay, since the doctor is saying that there's a cheaper way or another cheaper method, they may consider to reduce the cost calculation. And also, about the predictable reduce of life expectancy, we will asking the doctor's advice, saying that, okay, you want reduce this impossible for you to reduce life, and which we can make the assessment period into 5 years to reduce the costs. And I put this here because lots of the health condition happens in parents' visa. Not only because parents age are old, but also the waiting period for parents' visa is super long, and which give us the opportunity to plan ahead. Here I have two advice to clients, especially for the long waiting period visas application. So first, we can expect a change of cost in the future. This is the notes for guidance for HIV published this year, and this is the note of guidance published for HIV 9 years ago. And we're looking at the one of the medicine. Oh yeah, here we go. So we can have this. We can simply compare this is the same medicine, 450 mg tablet, right? Includes 6 tablets and 2 tablets daily. We can see clear from here. 9 years ago, the cost for this medicine the unit cost is 2,000, and the annual cost will be 250, 25,000. And the price for this medicine today, it's only 200 something, and the annual cost will be only 2,000. So there's a huge decrease for the cost of this medicine. There may be if a lot of reasons. Maybe the technology develop it, and maybe manufacturer, they control their costs or whatever. But it's clear that the cost of a medicine or a treatment methods may be changed in the future. This will be an opportunity for our clients if the current cost is high, but maybe in the future the cost itself will be reduced. And also, we're talking about the significant cost threshold. The current threshold is 86,000, right? I was thinking a couple of years ago, it's only 50,000 in total. So there is a possibility that the department, they change the threshold, they increase the threshold, and at the same time, the cost of the medicine, the cost of the treatments decreased. Then probably the client may meet the health requirements in the future. Yeah, and the second advice is, I mentioned before, that we can ask the client to complete some major surgery or treatment overseas. And this, because it's overseas, it won't be any burden in Australia. So, and the MOC will consider this. Okay, things are already done that. The cost will be reduced, such like that. So that's probably the advice we can give to the parents. Yeah, I think that's all for my presentation.